All right, good afternoon. I think we've got several folks. I can't tell exactly how many, but appreciate all of you joining us this afternoon. I just looked at my calendar and we've been doing this since March 16th, fighting the pandemic. And I just want to start off and let y'all know I'm looking at this, everybody that's on the video portion of this, and I see some folks got a virtual background like they're out at the beach. Somebody's in a car. I've got several folks in their offices. Several of you are working. So this aspect of this has been fun. But I think we've all struggled and found new ways to conduct business. And I just want to, from a chamber perspective, quickly let you know something that's been occurring since Monday, March 16th. And you may have heard several of us mention in our conversations through the media or emails or personal conversations about the leadership group that's been meeting every morning. So that group has been both of our mayors, James Ross, Kim Tedford with the health department, who I had never met before. But and Ryan Porter on our staff told me, he said, "You're going to love Kim." And I'll tell you, he's been right. Kim has helped lead through all this. Tony White from the mayor's office, the county mayor's office, along with Alex Reed, city mayor's office, Jason Moore, EMA, Ray Washington, Jackson-Madison County School System, and then Jim Farrell with Jackson Energy Authority. I bring up all those names to tell you that for the past 5 weeks, every day, this team has been meeting. Decisions about COVID-19 and this community's response have been made in this group. They've not been made individually. And just as recently as 2 days ago, Mayor Harris asked the group to go around and state their opinion about something. Mayor Conger chimed in there and directed us all to make sure we stated our opinion about some decisions we were going to make. And we've done that very effectively. And I will tell you from a chamber perspective, I think this approach, it has saved lives. It has caused us to see a lower increase of COVID-19 or a lower infection rate of COVID-19 in this community. And it's enabled us to do what we're talking about today, and that's begin to reopen this community. And that's extremely important. And what I want to make sure we do today is enable our speakers to tell you how we can do that most effectively. Because the last thing we want to do is begin to reopen, but then in a matter of days or a few weeks, have to make a decision to start that process and go backwards again. So that's the last thing that we want to do. So I will start with Mayor Conger. He jumped on here first, Mayor Harris, ahead of you today, so he gets to go first. And so I'll start with Mayor Conger and let him say a few words. What we're going to do is each of our speakers is going to talk for 5 or 6 minutes. Mandy White, who is our Senior VP of Economic Development, has all the rest of you muted. And we want you to ask questions, but we want you to do that through the chat feature. And so as you do that, after our speakers are finished, Mandy will read those questions to the group. We probably can't get all of them. If there are some that we can respond back to you by email, we will do that later this afternoon. Mayor Conger?
Thanks, Kyle, and good afternoon, everyone, and thank you all for joining. And Mandy, responding to your text, yes, I can unmute myself. So yeah, you look back and it's hard to believe it's been since March 16th that we've been meeting about this and coming up with plans and guidelines and developing to keep our community safe, to keep our city safe. I know it's been hard on you all. We're not immune from it as well. Until this call, I was sitting on my computer going through our city budget and doing a bunch of red marks. So we're not immune from it. But we are going to recover from it, and we're gonna come back and we're gonna do the things we can to ensure your business is successful, that our city is successful, our county is successful, and Kyle, I don't know if you want us as we go through this talk about guidelines, or do we do that now, or we go later on? Okay, I think let's go ahead and go now. And so, as most of you know, Governor Lee's recovery plan excludes 6 counties in Tennessee because we have our own fantastic regional health department, and we get our marching orders from Kim Tedford every single day. And so as we go through this, we've developed a plan. We developed a plan well before the state did. I think our group and our team has done a fantastic job of being proactive about all the steps we need to take to mitigate the impact of this virus. And so, restaurants will come in first on Monday, 50% seating capacity. And we'll share all this information. We're getting the guidelines because Mayor Harris and myself and Tony and Alex from my office are on a task force with the state on developing guidelines and that communication piece for the reopen and recovery phase. And so tables 6 feet apart, no bar area like around the bar, but the tables around the bar can be utilized. We're strongly encouraging your employees to wear masks, your guests to wear masks. The question has come up, how do I eat with a mask on? Well, you don't. But we want you to wear a mask as you're a guest coming in, going to your table, and take the mask off and eat then, and then when you leave, and practice social distancing. I think it's important that we understand that the steps we have put in place and the phases that we have all have metrics in them. They're all dependent on new cases, unknown origin cases, hospital capacity. And that's what flattening the curve is about. It's about making sure our hospital has the capacity to treat those who require hospitalization. And so the metrics that we have in place are solely dependent on what you do as a business, what your customers do coming in. And so we're leaning heavily on you as business owners and managers to ensure the safety of your employees and your customers so that we can continue in the phased process of completely reopening our economy. Because if we see those spikes come up, if our hospital capacity gets in crisis mode, then we have to go back. It's not something that we want to do. We don't want to penalize anyone. We want to make sure that we're all doing what we need to do. And I say, face coverings, face mask. You can get a monogram like my wife did mine. T-shirt. We have a video on our Facebook page, City of Jackson, about how you can make a face covering out of a T-shirt. So there are multiple ways to have face coverings. Make sure that everyone, your employees are washing their hands, you're sanitizing areas, and that we're doing those things we need to do. Just the basic good hygiene, keeping our germs to ourselves so that we can continue this economic recovery in phases, and we can get back up to a full open economy sooner rather than later. And I'll let Mayor Harris impart whatever he wants to now.
I see Mandy still got control of who talks and who doesn't talk with her button. Well, good afternoon, everybody. And for everybody that's on the phone and can't see, I want to tell you that we've got Kim Tedford on this meeting with us, as well as James Roth, CEO of the hospital. And they've been our guiding forces through this whole thing as far as what we're trying to accomplish and what we need to do. And we really appreciate them. And so if you have any questions for them, they're on here as well. Also, I want to say among that team as well is a guy by the name of Matt Marshall, and Matt is head of United Way, and Matt's done an outstanding job in coordinating, trying to get our community fed. And for those who are lacking in food, he's done an excellent job in coordinating with the nonprofits and the various sections of our community to try to get food to everybody that needs food, and he's done an outstanding job at that. As Mayor Conger said, this has certainly been a joint group effort trying to decide what's best for our community. How do we go about addressing this? I never dreamed we would ever have a pandemic like this that we have to deal with, and so this is all new, uncharted territory for us. We've made some really, really tough decisions that, and Mayor Conger and I have talked about this, that just goes against the grain of what we believe in and our freedoms that we have restricted and things like that. And we understand that, and we don't take that lightly at all. And you are absolutely the rock of our community, the small businesses. And we know that you've been struggling. I mean, we absolutely know that. We're struggling along with you, but I understand that it's been a trying time. It's not over. It's going to take a while to get over. I'm really excited to get started on Monday with restaurants opening. I understand as well from that perspective that, I mean, you are going to be able to utilize 50% of your seating capacity, but that's not what your business is structured for. Your business is structured for 100%, but we've got to start somewhere. This is not absolutely not a perfect plan, but it's the best plan that we as well as the state have come up with. And I'll give kudos to the state in the sense of helping formulate these guidelines. And there are other businesses that are not open that are all being discussed, and when is the appropriate time to bring them online, and what will that look like when they do. I can't tell you the timeline because it's kind of a fluid situation. That we do have, I mean, part of the flattening of the curve, and I know you've heard that a lot, and that is that we know, number one, that we're going to have an increase in cases when we start on Monday. I mean, we're just naturally going to have more cases. The question is, how many of those cases are? And I mean, the bottom line of what we've been trying to accomplish is not to get into a situation like New York City finds themselves, and that is that our healthcare system is totally inundated. They can't handle all the sick people that are in their community. And our hospital has taken vast steps to, I mean, number one, no elective procedures. They have made cuts just to reduce the census in the hospital in anticipation and to prepare for if we do have a real spike in ours. They do have they have done an excellent job. They do have excess capacity. And I want to give you some numbers that JR gave this morning. I'm not trying to steal your thunder, JR, but today, now these are close numbers. Today, the census in the hospital was 420 patients. That has been hovering, give or take, anywhere from 330 to 380. So there's been a spike there. They have 27 ventilators operating today, but only 3 of those are coronavirus patients. But this is the thing I really want to tell you. The capacity of the hospital, they're sitting at 419 or 420 patients today. They have the ability to accommodate 667 beds in that facility. They have 27 ventilators running now. They have the capacity to operate 77 ventilators. So we feel like that the hospital certainly done its job in preparing for this, as well as getting the census where if we do have the spike, they can handle it. The main thing we wanted to talk to you about today is that we are opening, and I'll put out the same precautions that Mayor Conger did, and that is that we're putting a lot of faith and confidence in y'all as well as our citizens, because we can continue this, I call it unwinding of what we wound up here, if we can control and keep people as healthy as possible. And it's really inherent upon y'all to take care of not only your employees, but your customers. Now, at least at the courthouse, we're opening up back up the courthouse to the public on an appointment basis on Monday. Now, we will sometime next week open it up to a limited basis for the public to freely come in with limitations. And the reason we're not opening Monday is because we've got plexiglass ordered to go up on counters to protect our employees and to protect their health. It's on order. We've got some of it up. The other shipment won't come in until Tuesday. We hope to have that accomplished by Wednesday and open up so people can come into the courthouse. I suggest that you look at your business the same way, and that is that you, first off, you want to take care of your employees, and you want to make sure they're healthy before they come to work, and you want to keep them healthy while they're there. And the general public that comes into your place of business, I strongly suggest that you ask everyone to wear a face covering of some sort. It doesn't have to be anything fancy. It doesn't have to be any kind of material. It's just to protect your employees from the general public. So there's lots of cautions and precautions, but I believe we can make this, and I think that we can be successful so that we can continue to open businesses and get our economy back on track. So that's all I have right now, Kyle.
All right. Thank you, Mayor Harris. And we'll go to JR next. And JR, if you would kind of pick up on what Mayor Harris was talking about, the whole goal of this obviously is to save lives. By doing that, we have to flatten the curve. Number one, from your perspective, how successful have we been doing that? And then moving forward, what happens if we back up and start seeing a huge increase in cases because we don't implement and don't practice the social distancing guidelines like we should?
Thank you, Kyle. As far as West Tennessee healthcare goes, let me just talk about Jackson and Madison County. Mayor Harris is correct that with the governor and the local mayors guidelines that they've laid out, obviously a lot of our business, elective procedures and surgery shuttered. And along with that, it was somewhat surprising to me, but a lot of our emergency room visits that we typically see, they, I don't know, almost a third to a half of what we were seeing normally just at Jackson-Madison County General Hospital. So we used to see around 280 on average patients a day in the ER. Now we're only seeing 130, 140 patients a day in our emergency room. So all of those things that were put in place, not only does it affect you all's economic survivability, it definitely affected not only the economics of the hospital, but it also decreased a huge amount of our capacity, which was what was we were trying to do to allow us this anticipated surge that everyone had talked about. So thank you for your endurance through that. We have not seen, if you will, the huge spike and surge as what other communities have seen, although we have seen definitely an increase in the number of cases that Jackson and Madison County has seen. So that is still concerning to me from a hospital, physician clinics provider scenario. And while the governor has opened this back up and our mayors are planning to open this back up, I can't share with you how concerned I am or how much I ask you to be on board with the social distancing, the protections, and so forth, because it's not necessarily about decreasing the number of people that are affected. It's about saving lives. The number of people that potentially that can get this, your patrons, that can potentially die from this. And, there's some statistics on the certain gender, there's statistics on certain race and so forth being more affected. But I'll tell you, this disease does not discriminate. It's open for all of us. And so even with some folks that have been well protected or considered themselves well protected, we have seen them contract this infection. So I ask you very humbly to do those things. We have, if you have an employee, it would, and Kim, I don't want to take your thunder here, but if you have an employee, having some way to ascertain that they're not running a temperature or they're not showing signs and symptoms, even of what you would call seasonal allergies, that still to me is something to pay attention to. If you find employees in that shape or fashion, I ask them to seek some guidance, medical guidance, and they can call any of our clinics and seek some medical guidance about whether they should be seen. We have 3 or 4 clinics, and I know you all have seen those being advertised where we've designated, if you feel COVID symptoms, that you can come and be checked out. So I'll stop with that, but you all support in this has created this availability for the surge that we did not see as we had anticipated or had been told. Once we open this back up, if we're not cautious, that overwhelms a system where we could get out of control very quickly. And again, to the mayor's point, once you open this back up, we don't want to be in a scenario of having to shutter it back down, particularly from a healthcare standpoint. I'll pause there, Kyle, and take any questions whenever.
All right, we'll do, we've got the chat room. I see we've got 10 questions in there. And so Mandy, after Kim speaks, Mandy White will chime in and read through those questions for us for the remainder of this call. And I'm going to brag on Kim Tedford one more time before she starts. When you're in the chamber business, you don't interact with the folks at the health department too much. And I mentioned that earlier, but I will tell you, without Kim and her team, we would not be where we are today. I know a lot of you that are in the restaurant business, especially on the inspection side, you're familiar with the health department and those folks there, but they are unknown typically because they operate and you don't want to see what they're doing. At this point, Kim has been out front, her team has been out front, and they are a huge reason that we can even have this call today and talk about reopening. So Kim, with that, if you can kind of tell us where we are as a community. And then one of the things also we talk about a lot is that with Jackson, we're the centerpiece of the region, and we're the hub city, as a lot of folks call it. And when we open up, we're going to have folks from surrounding communities coming back in here. We want them to spend their money, eat at our restaurants, and go to our stores, and just talk through a little bit about that impact and more guidance on what we should continue to be doing so we can prevent what JR just talked about.
Sure. Good afternoon, everybody. Thank you for the kind words, Kyle. Can I just say I wish I was in Ben Ferguson's background. Wish I was on the beach. No, many of you in the restaurant business probably have received the guidance. I think Candy Overstreet is my environmental health director, and she was going to send that guidance out after my call this morning to all the restaurants that they have contact information for, so you should have received that. I'm not going to go into those specific guidelines. Let me just say kudos to all of y'all from a public health standpoint. It's not me and my staff that have kept these numbers down. It's what you guys have done to protect the public and to protect your employees and do the things that we as public health have asked you to do. And I just, from that standpoint, want to say, please continue to do what you're doing as far as protecting not only your business, but your employees and the customers that come through your buildings. You're going to be asked to do some things that you don't normally do in your business. And if you can just continue to practice social distancing, to have some kind of face covering, we ask that you ask customers that come to your businesses to wear that. And that's just to protect your employees, yourself, and other customers in the facilities. Please, 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 and I know you hear this from my inspection guys all the time, those of you in the restaurant business, but things as simply as washing your hands with soap and water for 20 seconds, using hand sanitizer when available. And I know I've heard from Candy, from several of you, that you're having a hard time getting those kinds of products for your places of businesses. Don't feel like the Lone Ranger, because we in the healthcare facility are having the same problems that y'all are as far as getting some of these items. But just the social distancing, I know that's going to be hard as far as your employees. The biggest thing that I'm going to ask those in retail and restaurants to do is to screen your employees when they come to work, because that's vital. If you're able to take their temperature, that's great. But if not, please question them about how they feel, if they're having any symptoms of COVID-19. I know fever is a big deal, but what we're seeing a lot of times with these COVID-19 cases is that people aren't necessarily developing a temperature until day 8 or day 10 of their illness. So please pay attention to those respiratory symptoms that they may have and ask them how they're feeling. And so not putting them in the position to have the potential to spread COVID-19. Again, the places that I've been into and places where I've gotten takeout from, I think kudos to all of y'all for the job that you're doing. And I just ask that you continue it. We in public health, we can't prevent people from getting COVID-19. It's here, it's going to spread. What we can do is to mitigate or slow that spread down so that it doesn't have a negative effect on our healthcare facility and our healthcare institution here. Yes, we want people to come from other counties to spend their money in our county. And let me assure you that we work closely with the West Tennessee Health Department. They cover the 19 counties around Madison. And my epidemiological team is in contact every day with them. We're talking about cases that cross over, cases that they may have that work in our county and vice versa. So we're in constant contact with them. They have a good handle on the cases that they're seeing in their counties, and I'll be glad to take any questions, Kyle, when if any come my way.
All right, thank you, Kim. I heard you compliment Ben's background there, and you all know he is not at the beach. He's just smart enough to figure out a virtual background. And so if any of you need one, we've actually got a bunch of those up at jacksonforwardtogether.com. That's a microsite off of Jackson, our chamber website. And there's several of those that you can pull down. They're all based around Jackson that you can get those. With that, I think all of you can see why we've been successful. That's just 4 folks that are in that group, but these are the 4 people that have really led those discussions, and the decisions have been made around health and then the economy of how to reopen this. And so we are where we are today, looking forward to Monday and doing that the right way. I'm going to switch over now and let Mandy take over and moderate the discussion part of this. And we've got right now I see 113 people on here, and it would be impossible to unmute microphones and have all the feedback and everything with that. So if you haven't already and you have a question, put that in the chat feature there, and Mandy will start now reading those questions, and then we won't direct who responds to it, just you guys, the 4 of you, whoever feels best to take the question, go ahead and respond to it.
Perfect. Thank you, Kyle. Can you guys hear me okay? Great. The first question is, who do we turn to for questions that are specific for buffet restaurants?
I'll take that question. Can you hear me? Those questions, I think, can be directed to our environmental department, Candy Overstreet, or myself if you have specific questions right now. The reason for that guideline that came down, as we all know, when you are serving yourself at a buffet, you've got multiple hands that are coming in contact with those utensils that put that food on your plate. And while it is a lower risk to spread the virus that way, we still have no control over what people do and their hygiene habits and whether or not they're washing their hands or using sanitizer or that kind of thing. And they're going to come in contact with those utensils that everybody's touching. But if you have specific questions, you can, as far as the guidelines go, those can go to Candy Overstreet or any of the inspectors.
Along those lines, someone asks, the extra guidance for buffet restaurants may cause consumers to be less confident in dining at buffets other than food service or than other food service establishments. Is there anything that the team can do to help us in reassuring the public that buffets are still safe to eat at right now?
And I would just ask people that do have buffets, if there's any way that you can have staff that could serve the food from the buffet to people's plates. That's one thought. And I'm not sure about any kind of encouragement from anybody else's standpoint as far as it being safer to eat than at any other food establishment. I don't know if I have a good answer for that.
Okay. Someone asks, what happens if a guest gets infected and then they came to my establishment in the last 14 days? Will I have to close?
I'll address that too. Here's what happens when we have a confirmed case of COVID-19. We contact that person, and then we do what's called contact tracing. So we are going to ask them a myriad of questions about their behavior in the last few days. We determine what their infectious period is, and we ask them a multitude of questions about what they've done, where they've been, who they've come in contact with. So if they have been in your establishment, then we will be in contact with you and try to figure out who they have been in contact with. And it's not necessarily going to close you. You know, you may ask to do an extensive cleaning of your surfaces and tables and that kind of stuff. But as far as closing you, I don't see that happening unless there were multiple people in your facility.
Okay. Maybe somebody else can help you with this one. Clarification on whether the following items are mandates or recommendations, and there are 4. Testing consumers for fever, testing team members for fever, facial coverings for consumers, facial coverings for team members. That may be you too, Kim.
All the guidelines that came down from the state and from the governor's office are all recommendations and guidelines, but these came about from being best practices during the time of COVID-19 infection. So while I don't see anything in them that mandate anything, they are recommendations, and they're recommendations based on best practices in this situation. Now, the mayors may want to address Scott.
Apparently he can't unmute. Let me.
Now I think it might.
There
Yeah.
you go. There you go.
Put me back on lockdown. I didn't follow the
do it on
guidelines.
purpose.
That's what happens when you don't follow the guidelines. You get put on lockdown again.
That's all right.
So while they're not mandates, understand, you know, what we talked about earlier, that if you aren't checking and screening your employees, if you aren't screening your customers, as a business owner, you have the ability to require anyone who comes in your front door to wear a facial covering. If you're not encouraging or requiring your employees to wear facial coverings, your customers to wear facial coverings, and the virus spreads, our hospital capacity gets dangerously high, then we go back to step 1, which is stay-at-home order, and the business closes. So while it's not a mandate from us, it is a strongly encouraged, but understand that if you are very lax on what you require in your establishment, then that increases the risk of the virus spreading, and therefore retroactive steps could come into place.
Well,
Go ahead.
I would also like to add, Mandy, that everybody on this line and everybody in Jackson, actually everybody across the state, has the exact same guidelines. And so, and these guidelines, and I'd like to tell you, the governor set I guess you call it a task force together. Commissioner Ezel, Commissioner of Tourism, heads this up. And they got people from restaurant industries, from hotel industry, from all businesses to help structure these guidelines. And we, as Mayor Conger said, we have a conference call with them every morning to discuss and refine these guidelines. So just think about this. If everybody on the call here today that's in a business pays no attention to the guidelines, then within 2 to 4 weeks, I predict we would be tightening back down, because we're going to have, it's going to get out of control. Also think about if these are not mandated, but they are real strong suggestions. If you don't take the temperature of your employees, if you don't follow up on them and make sure that they're well, if they get sick, then that puts all your other employees to the point that Kim is going to say to you, all those employees need to go home and quarantine for 14 days. Now just think about that.
Kim's going to say that, not us.
We had a policy.
Kim's going to say that, not us.
We've had I think 3 people that worked at the jail that were employees, and they were positive. So of course they were sent home. but we had at one time something, a little over 20 employees on quarantine for 2 weeks because of one or two employees there. So you run that risk if you don't take care and look after and make sure you follow the guidelines on employees. And as well, I'll shut up in a minute. But don't be the spoiler in this. Please don't, because it's gonna take us all, and we're trying our best to get you back in business. And it's not perfect, and it's not perfect for your business, but it is allowing you to get back in business. So please take heed to these. I'll shut up.
There are a couple of more questions that fall in line with those safety measures. One is, does a business have the right to deny service to someone that is not complying with the safety measures that they have determined are required?
Yes.
Yes.
And as a follow-up, what are business owners to do when customers do not want to comply? Will business owners need to have someone in the store to monitor this? Will there be recommendations for companies to know how to handle these situations?
I think probably the same goes along the lines with our large retailers. We had a conversation with them before we went to the stay-at-home order about what they were going to do, and they had designated staff. I know some of you are small businesses, and you can't just designate a single staff person or a group of staff to monitor this, but empowering the entire staff to monitor that if someone doesn't come in with a facial covering, that they're notified and they're asked to leave. Our codes department is going to be doing some spot checking just to see, what the guidelines are and what businesses are doing, just to make sure that we're all on the same page. So, hopefully it doesn't get to this, but, worst case, you can always ask for law enforcement to come if someone's refusing to leave. I hope they understand what your guidelines are, and then you don't get to that point. But if you want to ask them to leave because they're not protecting themselves and protecting your other customers and your employees, then you have the authority to do that.
Okay. Specific to dentists and dental specialists have been seeing emergency patients only since mid-March. Our national and state societies have recommend that we follow state and local guidelines for resuming non-emergency procedures. Are there any specific guidelines in this reopening for business in Jackson-Madison County plan regarding dentistry?
No, I think our guidelines, and I'll let Kim answer the rest of it, defer to the health department in the state. So that's a Kim question.
I don't know that it's a Kim question, but the closure of dental offices came from the state level. And let me give you a little bit of reason behind that. There's always been the issue of enough personal protective equipment for healthcare providers in all communities, not just in the state of Tennessee, but nationwide. And so dental offices were asked to cut back and close and only see emergency situations to preserve that PPE so that people like JR's hospital and his employees could have access to that PPE to take care of patients. So it's not going to be us that tell the dentist and dental offices whether to open or close. I think that has to come from the state level because they were the ones that asked them to close to begin with and shut that down. Just like elective procedures, I think, JR, you want to talk about that? JR's going to speak to
Let me make sure he's unmuted.
Okay.
Yes. So can you hear me?
Mm-hmm.
Yes.
What we're doing at Jackson General, we're starting off on May the 4th, and we'll start in a slow methodological process of doing some elective procedures, but something that we've had to rechange our thinking. You would normally, just kind of run elective procedures in a normal fashion. You can't do that. So we're having to look at everything of how we pre-screen patients before we do those elective procedures on them. And that means that's going to take extra time before they get here. But then even in this setting, this healthcare setting, we're putting added measures in place where it will take for the procedure time and all of that is going to be longer. So even in the far distant future, the way that we take care of patients in the past is definitely going to change. And so our efficiency is going to be slowed down greatly. I'll go ahead and tell you that we are maintaining our restricted visitation for the hospital. You know, if you're pregnant and getting ready to deliver, you can have one person, support person with you. And obviously, if you're in a terminal situation and not expected to survive, you can have someone at your bedside. But outside of that, we're restricting visitation still. And if I could, I want to talk about temperatures. You know, we're healthcare and we consider ourselves supposed to be knowledgeable about this. But, you know, we've had a good number of people, employees, that have tested positive even under our protections and even under their knowledge of social distancing with families and things like that. So I say that to say we have all of our employees each day. They have to sign in. They either check their temperature or it's checked for them. We're fortunate to have the little zapper thing where we don't have to actually touch the employee. We're continuing, and we write that temperature down. We are keeping a log. I'm not saying that you should keep a log at all, but we are keeping a log just for an accountability standpoint, to make sure that whoever's here working, we can look at that list. A supervisor can look at that list and make sure that they have checked their temp. All of those things, the social distancing with employees, nobody's within 6 feet of each other unless they're actually in patient care room taking care of a patient. But just to give you that type of scenario, that's for our entire patient population and our entire employee population. I'm not saying that you guys should keep a record, but just to give you, that's an example of the intensity that we're doing here.
Okay, a few more questions. When can the funeral service community begin to serve families?
I think that's a few weeks off, and we're relying on the state to look in congregate kinds of businesses like that, because that's it's kind of like nightclubs and bars and things like that is what the state is calling in the not now list, and there's no real definitive time frame on when that will occur. But I think it all is dependent on that curve and how we're doing and how we progress. And if we can open a little more businesses in the next wave, and we keep that kind of constant or within a reasonable level, I think we'll move on to that. But there's no definitive time on when that's going to happen, Bob.
I didn't say who asked the question.
You asked the question.
one question here, and this probably is a Kim question, maybe JR. On Salus Halo Therapy, which helps clients with respiratory issues. Obviously, I can check a client's temperature when they come to the store, but most of my clients already show respiratory symptoms, and that's why they come see me. Other than asking them to wear a mask, what are some precautions and maybe additional screening items we can do to make sure we are staying safe both for ourselves and our clients? And our clients, by the way, are in rooms by themselves.
Yeah, that is the hard one with people that are already exhibiting respiratory symptoms. But yes, I would definitely have them wear masks. You might ask them if they've been around anybody or have anybody in their family or close contacts that have tested positive for COVID-19 or in the process of having been tested and they're self-isolating or quarantining themselves. Those are some questions that you can ask. Have a hand sanitizer there available for them to use. Just your normal social distancing, things that we ask you to do. And this is for everybody too. CDC.gov has some good signage that you can put in your businesses that you can just print off that ask questions that it really gets your attention to say, have you been experiencing any of these symptoms or fever or anything like that that you can post at your entrances maybe. If you go to cdc.gov, you'll see the section where it's got some printed out versions that you can just print from and use the signage.
That's a great advice. Okay, 3 more questions. You still have a couple of minutes to submit more if you have any. Should we recommend that any business that is able to reopen by appointment only do so for the next 2 weeks?
Yes.
Go ahead,
Okay.
Scott.
I was going to say yes.
I was
Okay.
too.
Is there a reason why we are going straight to 50% capacity when the White House recommended 20 to 25% and building to additional capacity after that?
I think our 50% capacity is based on seating capacity. Probably if you go to, for restaurants, if you look at building capacity, it's probably closer to 20%, but you're looking at just seating capacity.
But I think a big part of the reason here is that the governor is looking at and talking with the Department of Health there, who is getting their guidance from CDC. And so I think there's no doubt, folks, that this is a cautiously optimistic procedure, but it's not fail safe. It is just not. And so their opinion is that we can move this direction, but we're trying to tiptoe into it so we don't get wet all at one time.
Okay. Mayor Conger, this one's for you. Mayor Conger announced May 4th as being the goal date for med spas to reopen. Today, Governor Lee stated salons and spas would remain closed until mid-May, possibly. Is this guideline the same for Jackson?
So a goal date is exactly what that is. It's just a goal. And so, that depends on all the metrics being met. Phase 1 could last 1 week. Phase 1 could last 8 weeks. And so, again, it goes back to the governor's executive order for recovery covers 89 counties. We're in the 6 counties where we can develop our own recovery plan. We do take guidance from the state on this. But yeah, goals are just that. And so if we can meet them, then great. If not, then we'll push it back another week or another week.
So if the governor says mid-May and it becomes that's his date, but ours is sooner, will we adhere to his date, or we have the ability to open sooner?
We have the ability to open sooner.
Okay. Couple more. Chance to reiterate this again, because I think it's worth it. Our restaurant's the first to open on Monday. When do retail open, and are masks to be worn by all customers?
Restaurants open on Monday. Retail opens on Wednesday. And yes, masks are to be worn by all customers.
Strong recommendation, right?
Yes.
Okay, the last one. There are several disinfectant cleaners out there. Are there specific ones or maybe a main ingredient recommended for cleaning between clients?
I think it's the FDA's website, and I may be misquoting that. Scott, do you have that? There's a website, I think it's FDA's. I can get back to you on that, but that gives a list of cleaning agents and disinfectants that can be used.
Okay, we can share that information on our site. Kyle, those are all the questions. Well, there's one more that just came in, last one. Christ Community Health Services is hosting a drive-through testing site next Friday, the 1st of May from 1 to 3 p.m. If anyone, I guess this is just information. If anyone needs testing done before then, we have 15 patient appointments available at 4 o'clock every day, starting Monday for drive-up testing. If patients would like a drive-up appointment, they need to call, and the number's in the chat, and schedule a lab-only appointment, and these are free. For any patients who need testing and to see a provider, they will be booked in a provider appointment slot and will have to pay the sliding fee based on their income if they're uninsured. So that's just a statement, I guess. And Kyle, those are all the questions from those watching.
All right, I'm back. Thank you, Mandy. And thank all of you for the questions. Thank everybody for jumping on here today. We're going to continue doing these. I think if there's one thing something we've gotten really good at, all of us, it's a Zoom call, a GoToMeeting call, or Microsoft Teams or whatever. And this stuff works. There's a lot of, it would have been impossible to get 112 of you in the chamber boardroom downstairs today to get this same kind of information out. So we're going to keep doing this. Some of you joined, I know, after we had already been online for a few minutes. If you'll look at all of our social media sites, the chamber, these will be up today. And so you can connect to those and push them out. And if there's any questions you've got, you can send those to us and we will get those answered either from the mayors, JR or Kim. And looking forward to Monday. And I know all of us are going to do the right thing and continue to flatten the curve, keep folks out of the hospital and keep us all safe. And we look forward Monday to visiting our favorite restaurant and Wednesday shopping in our favorite store. So all of you have a great weekend.
Bye, folks. Good luck.